Hi again. We are going to talk about pain. First, we have to remember that sensory stimuli are captured by specific receptors, and then these receptors transform these stimuli in a neuronal signal. There are different types of sensory modalities, as touch, temperature, movement, pressure, chemical, light, and sound. The receptors used to be specific to a stimulus, but most can be stimulated by various modalities. Also, this is a very simple to remember, but according to Sherrington, the receptors could be divided in exteroceptors that are in the skin and mucosas, proprioceptors in bones, joints, and muscles, and interoceptors in vessels and viscera. When we are studying pain, we have to remember that pain is not a sensory modality. Since we do not give pain to the patient, we evaluate pain. This is important. What it means, pain? It's a word that comes from Latin, suffering. The International Association for the Study of Pain says, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. But we have to introduce another word, nociception, from Latin, noceo, injure, and take. That means this is the reception, conduction, and processing of painful information. It involves specific receptors and pathways. So when we are talking about the pathways, we have to talk about nociception. And when we are talking about the interpretation of this stimulus, we talk about pain. There are different types of pain and pain-related definitions, etc. Okay, classification of pain based on duration, classification of pain based on pathophysiology. Okay. However, where are these pathways of pain in the spinal cord? Right. There are several pathways that transmit nociceptive information. First is the spinocervico-thalamic tract. This tract, we will see this tract in histology later. This tract is in the lateral funiculus and is important in carnivores. This tract reaches the lateral cervical nucleus, and then from this nucleus, located at C1, C2, cervical spinal cord, crosses the midline and goes up to the thalamus, joining the medial lemniscus. There is also the spinothalamic tract, bilaterally. Well, this one is bilateral as well. But the spinothalamic tract is most important in primates, and it's mainly contralateral. Okay. Then we have also the spinomesencephalic tract, located in the ventral funiculus. Fibers decussate in the spinal cord and reaches contralateral mesencephalic nuclei and thalamus. And finally, we have the spino-reticular tract that transmits information of visceral information. Okay. So here we are at the level of C1. This is the dorsal horn, the ventral horn, the central canal. This area here has been enlarged in order to identify the lateral cervical nucleus. This is this collection of soma, of somatic neurons right here. And when we see this nucleus in a dorsal section, we see these neurons here that belong to the lateral cervical nucleus. Or in Bielchowski's, right, you have here, this is the lateral cervical nucleus to be found at C1 and beginning of C2 spinal segments. We have to talk about the pain inhibiting system, because the periaqueductal gray matter here receives information from several areas. thalamus, hypothalamus, cerebral cortex, spinothalamic tracts. This periaqueductal gray matter sends information to the dorsal longitudinal fasciculus to act on general visceral efferent nuclei of the brainstem and also reaching the cervical spinal segments, and also sends information to the medullary reticular formation and also to the raphe nuclei. These, the medullary reticular formation, they are neurons that produce noradrenaline and in the raphe serotonin. All these neurons go back, they go down up to the dorsal horn. What they do there? They inhibit the ascending fibers to the thalamus. And also they excite inhibitory neurons of the dorsal horn that use inhibitory neurotransmitters such as GABA, gamma aminobutyric acid, glycine, and enkephalin. So there is a pain inhibition system. Also, the locus coeruleus is participating in this pain inhibiting system. Okay, here you have a transverse section, and it's a Mulligan staining where you see the periaqueductal gray matter surrounding the mesencephalic aqueduct. And there you have the raphe at the medulla oblongata. So, summarizing, when nociceptive stimuli enter the spinal cord, this information is transmitted through nociceptive tracts up to thalamic areas, right? However, also there are information that is transmitted upwards through the spinomesencephalic tract and other nociceptive tracts that reach the prosencephalon. Prosencephalon activates the periaqueductal gray matter that projects to the medulla oblongata, and through serotonin and noradrenaline, they inhibit the oncoming sensory activity, activating inhibitory neurons. So there is a summary again here. Imagine here you have the dorsal horn and the information, nociceptive information, is entering the dorsal horn. These neurons and these axons send collaterals to interneurons. These interneurons produce enkephalin and endorphins. What they do is they act in inhibiting this presynaptic activity. So it's a way of controlling pain. We have to remember that the nerves are composed of motor fibers, sympathetic nerve fibers. Remember what we were talking in the autonomic nervous system. Sympathetic nerve fibers, there are from the great communicating rami, and they have sensory fibers. These sensory fibers, they have nervi nervorum. So these nervi nervorum are fibers that innervate the endoneuron, perineuron, and epineuron. And they are sensory for the inflammation, stretching, and compression. And they originate directly from the nerve trunk and from the blood vessels. As you see, some of them are originating from the blood vessels, and some of them are originating from the nerve, right? These fibers are involved in the neuropathic pain. Also, structures that are innervated by the autonomic nervous system, they send nociceptive information, okay? And they use the glossopharyngeus, the vagus, when they are from the cranial area. Also cardiac branches, great splenic nerve, lumbar splenic nerves. Remember that this is sympathetic, this is parasympathetic. And also parasympathetic, again, for the organs that are in the pelvic cavity, right? The pelvic nerve is the in charge nerve to transmit nociceptive information, and the pudendal nerve for the vagina and uterus. Other structures are related in controlling and feeling nociceptive information and translating it in pain sensations. The basal nuclei are involved in most aspects of pain processing for cognitive dimension of pain. The amygdala, you have this amygdala here. We were talking about these basal nuclei in other neuroanatomy and neuroanatomical lessons, like the amygdala, plays an important role in the emotional evaluation of sensory stimuli. Other centers, as the septal nuclei, okay, this is the telencephalic septum, okay, the cellular portion, remember, cellular portion is located here. Here, a big up is the pellucid portion of the septal area, because these nuclei have acetylcholine, noradrenaline, and opioid peptides. And also the locus coeruleus, because it synthesizes and stores and releases noradrenaline. And noradrenaline has widely demonstrated its role in pain modulation and is a main neurotransmitter in the locus coeruleus. Thank you very much.